Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com. Well, literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality, disease-free years as possible. Thanks for joining me this week on Tandem Radio and hosted by The Bridge. I want to give thanks to both Tandem and The Bridge for allowing me the opportunity to speak to you guys every week. We're going to be covering arthritis today. So we're going to be talking about the A word, arthritis. And as so many Americans have this condition, we want to do a breakdown of what it is. And as students of By Design, you realize that we take a very literal approach to understanding what certain conditions are, and also the design. That's why my show is called By Design. How are we designed by God to take better care of ourselves? So in looking back over my shows, you now know that there's a common theme to how I built my curriculum, and it's focused around the physical, the nutritional, and the psychological health of an individual, and how every day, each one of us, as this year we started by buying a health journal, in reviewing our health journal, and we probably have about 45 shows under our belt right now for the year, you'll see a common theme just in the titles of my shows. If you go to my YouTube channel, where we save every one of these shows there, the common theme is physical, nutritional, and psychological. God has equipped us with a physical state, a nutritional state, meaning that we need biochemistry to nourish ourselves, and psychological. How do we nourish? How do we manage the brain, this beautiful structure between our ears that we spent about 12 weeks talking about this year? So here today we're going to be talking about a condition, and the condition is our body develops arthritis. And arthritis is such a vague word, meaning it encompasses so much, that we're going to take it apart today and really look at it from its root. So remember Luke 1:37, for with God nothing is impossible. Nothing is impossible because we are bestowed upon us a miracle of a creation called the human body, a miracle of creation called biochemistry and nutrition. And the way we get to feed ourselves every day will have a direct impact to our overall health, how we feel, how we function, and how long we live. And finally, like I've shared with you, the 3-pound structure that lays between your ears, the human brain. The biggest miracle in the universe is the human brain. So God's handiwork is us, and as we look at it, it's our job to take care of it. So let's take a look at arthritis. And arthritis, as defined by the CDC. I blogged on arthritis at drproodian.com back in January of 2014. So feel free to go pick up my blog on my website, drproodian.com. So according to the CDC, approximately 1 out of 5 Americans have been diagnosed with arthritis. Okay, that's a good amount of people. By 2030, the percentage is expected to jump to 2 out of 3. So this is obviously a condition that affects the majority of Americans. So the word arthritis has a very literal definition. It's combined from a Greek word called arthron and a Latin word, which is itis. And if you don't know what itis means, if you stick itis on the end of any word, it means inflammation. So if you have colitis, that's inflammation of your colon. If you have pancreatitis, that's inflammation of your pancreas. If you have neuritis, that's inflammation of a nerve. Here we have arthritis, which is inflammation of a joint. All right, so general symptoms of arthritis is joint inflammation. Sometimes there's redness, there's swelling, there's pain, there's heat, and there's stiffness. Now, arthritis is not just one disease. It's actually made up of over 100 different medical conditions are classified as arthritis. So you're probably sitting there and like, wow, which one, do I have? Well, the most common form of arthritis is the wear and tear type of arthritis, which is called osteoarthritis. And this is developed by most people over 50 as the cartilage starts to break down. Okay, so osteoarthritis, not just arthritis, we're talking about a very specific now form of arthritis called osteoarthritis, which is the one that affects most Americans, hits them in the joints. This is the wear and tear, okay? It's usually found in the hands, the knees, the hip, the spine. Okay, it also could occur in any joint. Common causes of what we call OA, osteoarthritis, include obesity. Injury causes osteoarthritis. An inflammatory diet, because once again, we're dealing with an itis. Genetics, and repetitive use of a joint over a long period of time, often caused by a physical job. So if you're a mechanic, right? If you're an electrician, carpenter, plumber, if you're a gal raising children, you have repetitive physical jobs. And those repetitive physical jobs could wear the joint down. All right. But what a lot of people don't realize is even sedentary jobs, which is what we're going to talk about too today, even those sedentary jobs like working behind a computer, okay, for long periods of time, not really doing anything physical, will cause the obesity, will cause the inflammation, and will cause your body to be in a deconditioned state that can also impact osteoarthritis. So there are other forms of arthritis, not osteo, that fall into the autoimmune category of arthritis. These types of arthritis occur when the body's immune system attacks healthy cells. All right, so this is not the type of wear and tear. This is when your immune system attacks itself. These forms of arthritis are called idiopathic. Idiopathic basically means we don't know where they come from. Wasn't that wonderful? So idiopathic arthritis, like let's take rheumatoid arthritis, which is a very common form of an autoimmune arthritis, is found in the wrists, the hands, the knees, and usually on both sides of the body. And it's more prevalent in women. RA, or rheumatoid arthritis, is more prevalent in women. It often strikes in like kind of the middle-age kind of years of our life. It can also affect younger people, and that's called juvenile rheumatoid arthritis, okay, including children. So there is a direct difference between the wear and tear arthritis and the autoimmune arthritis. And it's very important to know the type of arthritis that you're treating. As a doctor, as a clinician, I'm a sports chiropractor. I treat these conditions for my living. You do not treat rheumatoid arthritis or lupus or gout or psoriatic arthritis, which are all autoimmune, the same way you treat osteoarthritis. So it is very, very important. Rheumatoid arthritis can affect other things like your eyes, your mouth, your lungs, your heart, okay? And scientists have not been able to identify the causes of RA. Although, genetics, environmental lifestyle, and hormones definitely play into the triggering of the autoimmune. Now, some of you out there, you know what epigenetics is. We've discussed it. We allow stress to enter our body. It is uncontrolled stress over a long period of time, and it triggers off the epigenetic code in our cell, our DNA, to allow the expression of something like an autoimmune disease, in this case, rheumatoid arthritis or psoriatic or lupus. Many times I see in clinical practice, the reason we develop the autoimmune disease is because we allow it to happen because of our lifestyle, our eating habits, our physical stress, and our mental stress, okay? So we sometimes cannot control some of the factors that contribute to arthritis, for particularly osteo, right? Because if you're an electrician, a carpenter, a plumber, all the things, wear and tear, repetitive, you have to make a living. We all go to work, make a living, all right, depending upon the job that we have. What's interesting about, a classification that I work within is chiropractors. The number one reason of disability in chiropractors is back pain, all right? So, you take a look at the wear and tear and the stress of a job over 20, 30, 40 years. There's certain things we can't control. But this is what's kind of interesting. Let's follow this. Let's say I had an itis. Let's say I had osteoarthritis or rheumatoid arthritis or any inflammatory condition. Now, keep that over here for a second. If I had a swollen ankle and I got up on the desk and I jumped off the desk 15 times in a row directly on my swollen ankle, hopefully everybody listening to me would say, hey, James, that's not a smart thing to do, okay? That's really, really a silly thing to do because you have an inflammatory swollen ankle. Well, Most people, most Americans have an itis going on inside their body, yet they eat an inflammatory diet every day. 90% of the food that Americans eat is inflammatory. We've spent weeks talking about this. So it really doesn't make any sense that if you have any form of an arthritis, whether it be osteoarthritis, rheumatoid arthritis, any of the more than 100 medical conditions that fall into this classification, that you would eat an inflammatory diet or live an inflammatory lifestyle. God did not create us to live in an inflammatory state. Man created us to live in an inflammatory state. Okay, I'm taking my time with that sentence. I really want that to sink in. Write that in your health journal. God did not design man to live in an inflammatory state. We have the tools to eat, remember the triad of health, physical, nutritional, psychological. We have the tools to take back that inflammation. All right, we just have to know what to do. So eating an inflammatory diet is contributing to the daily inflammatory pain. I mean, I treat many laborers for my living. I see from chefs to people who work in kitchens, to people who mow lawns, to electricians, to plumbers, like I said. And most of these people coming into my office, the first thing I want to educate them on is, yes, okay, you have a degenerated disc in your back, or yes, you have osteoarthritis, but we must change your eating habits. Because if I'm going to treat an osteoarthritis, which by the way is treatable, okay, you really want to do something. If you have osteoarthritis of your hip or your spine or your wrists, there's ways, and I'll teach you in a second, one of the key things that I want you to do. If we have an osteoarthritic patient, what we want to do is clean up the diet, and secondly, we really want to build the soft tissue that surrounds the joint. So what does that mean? Most people who develop, let's take the most common osteoarthritis, what I see, every day in practice. You take an x-ray and you see osteoarthritis of the lower back, the lumbar spine. And most people will throw their hands up and say, okay, you have osteoarthritis, you have degenerative disc disease, it's a wear and tear arthritis, it's not an autoimmune, there's nothing you can do about it. Take Celebrex, take an anti-inflammatory, take Advil, take the over-the-counter medication, and call it a day. The problem with that is if we're really going to support the joint and the bone, we have to build a better girdle. Now, what I mean by girdle is your abdominal wall, your muscles in your rump, and in your legs. The stronger your legs and rump are, along with your abdominal wall, the less force and stress will go to the lower back. So even though we might have an inflammatory osteoarthritis or disc degeneration in the lower back, we don't surrender, throw our hands up and say, there's nothing we could do. Let me just go lay on the couch some more. Let me continue pushing a lawnmower around, and let me continue to have poor posture and poor lifting habits. No. Well, we should be smart about our design. God gave us the perfect bioengineered, biomechanical body. Our job is to maintain it. So no matter what state we're in, there's something we could do for it. Whether it be our neck, our mid-back, our low back, our hips, even our knees. I mean, nowadays with advancement in surgery, and I thank God for the advancements of surgery, particularly in knees and hips, and there is a real place for that. But if surgery is not the option, or if you've already had surgery, what are you going to do now? Are you just going to get a new hip or a new knee and say, okay, I got my new hip or new knee. Now I'm not going to do anything. I'm not going to support the surrounding soft tissue. So remember the idea of having a girdle. You think about taking an actual piece of equipment like the gals used to do 100 years ago or so, and tighten everything in there. We want to take all of that muscle, all of that soft tissue that supports the lower back or the mid back or the neck, and make it stronger. We want to make it more stable. We want to learn the stabilizing exercises, learn the strengthening exercises to support the underlying arthritis, because I say this probably 100 times a week. Mrs. Jones, when I take this x-ray again on you in 5 or 10 years, I don't want to see it any worse. So if I have someone who's a phase 1 or phase 2 degeneration or osteoarthritis, my job is to help them not to make that condition worse. My job is to support the condition by making them stronger. So if you've been diagnosed with osteoarthritis, disc degeneration, let's do something about it. If you're listening to my show, you know my attitude towards health is you better be proactive. You better learn and be more literate about the physical, nutritional, psychological approach to taking care of ourselves. Chronic illness is an all-time high, and God gave us the knowledge through the sciences that he created to allow us to utilize his plan for our health. And this is one example of a condition that is plaguing, by 2030, 2/3 of Americans. It's costing us dearly, guys. We're paying for all of this, and we can do something about it. And I pray that you do. Thank you for listening to me, Dr. James Proodian, in a By Design radio program. If you want more information about me, please go to ProodianHealthcare.com or go to my blog, which is drproodian.com. And remember, I'm setting up my 2015 calendar. So if you'd like a By Design event at your church, please contact me through my website, and I'll be happy to help you schedule a By Design 90-minute public speaking event for your church. Thank you, and have a great week, and God bless.